So now, I would imagine you get patients who come to you with all kinds of different skin conditions. And I would imagine if they went to a traditional dermatologist, they would have one kind of treatment, and yet you have different kinds of treatment. So tell us the difference between what a regular dermatologist would do and what you do.
Well, there's a whole series of different treatments that dermatologists have developed, and I learned those. They work very well. But they have a certain cost to them because many of them are treating symptoms. And for instance, the corticosteroids calm down the inflammation, but they don't always get at the cause of the inflammation. So if the cause of the inflammation is a dietary habit or is contributed to heavily by a dietary habit, putting the cortisone on will give you a wonderful relief, but when you stop putting it on, the problem comes back. Mm-hmm. And unless you correct the underlying cause, you still have a problem. So I treat a lot of conditions that have inflammation by working my way back towards the underlying causes, getting the digestive system working better, ferreting it out which things are causing it, getting the liver to help detoxify better, using anti-inflammatory herbs. So I'm able to avoid a lot of the drugs that my colleagues need to use on a daily basis. In acne, people use a lot of antibiotics, dermatologists, for treating it. Acne treatment with antibiotics has its cost because people then sometimes get overgrowth of yeast in their intestinal tract, and then they can get, even in the worst cases, chronic fatigue, and they can't function. So I work with the process of inflammation, of calming that inflammation through changes in the digestive tract, working on the hormonal basis of the acne using a variety of supplements that gently shift how the hormones are working in a safer way, mm-hmm. because some of the side effects of the supplements I'm using are reducing the statistical chances of breast cancer. So I like a positive side effect. I like it when a patient is treated for their skin and their energy is better and they have more verve during the day and can get more done and enjoy life more. That's the kind of side effect I like to see. So I really enjoy working with people who have improvements in their overall health while we're improving their skin. So that's very different than what many of my colleagues do.